Welcome to She's Well, the podcast where we explore women's health and wellness from multiple perspectives. I'm Dr. Bushra Gul, a gynecologist, and today we are discussing an incredibly important topic, postpartum depression. Many women experience emotional challenges after birth, but postpartum depression often goes unrecognized and untreated. Today, we are here to shed light on the postpartum depression and its impact on families and the steps that can be taken for treatment and support. I'm joined by a special guest, Russell Hamming, a Dubai-based cognitive behavioral hypnotherapist, life coach, and author with over 35 years of experience helping people overcoming anxiety, depression, and panic attack. Russell has been featured on global platforms including BBC, ITV, and Forbes Middle East. Welcome, Russell.
Thank you for having me.
Yeah, no, it's amazing. And I know you for some years, for some good, maybe pre-COVID time.
Yeah, we go back a while, definitely.
Exactly. And you've been always amazing when I meet you and I see you when you're dealing with your clients. You really have that empathy, which I see a lot of psychiatrists or psychologists might be lacking.
I'm sure there's some good ones out there, but thank you for that.
Yeah, exactly. So we'll be discussing postpartum depression, and I'll be reflecting some of the cases which I saw during my practice, and you'll be shedding light on those. So I have pleasure of knowing a couple who was really amazing and beautiful young couple, and whenever they used to come to my clinic, they used to be really filled with joy and excitement. And I delivered them for the delivery of the girl. Her mom flew in from the country to support her. Everything was good, and there was a good outcome of the mother and the baby. And then they came to me for the postpartum checkup in the clinic. Mm-hmm. And everybody sitting so comfortably and nicely. And suddenly, this girl broke into tears. Mm-hmm. And everybody just stunned because environment was so good. Suddenly, everybody's eyes searching answer, what happened there? And this girl herself was also surprised and thinking, what just happened? So probably she just had this sudden emotional wave, being a new mother, being so overwhelmed with the pressure, with the sleep deprivation and the responsibilities. So then, but the good thing which stand out in front of me about their family, that they were being supportive. They were being non-judgmental. And then I have to just say something there. I said, it's just normal to be overwhelmed, and it can happen without you even realizing what's happening and without you knowing that there you are on the raw emotional landscape of being new mother. And they just went, and the very next time when they came, they were all well at it never happened. So I'm sure that was the family's support at home, and they supported her without being judgmental, and they let her go through and overcome this. And she was again back this joyful lady.
Yeah.
Yeah.
Well, I can tell you now that the people that experience postpartum, they sometimes are mistaken for baby blues. Yeah. So it's normal, isn't it, for ladies to have a baby, and in those first couple of weeks, they can get sad, they can get emotional, because everything's new to them. But that support that you mentioned contributed probably for her to just move on, and she was fine, as you say. But it doesn't always happen that way, does it? People can be judgmental in families sometimes, and say things like, if they're crying, oh, this is normal. And it usually is. But as you know, there is a small percentage that it isn't baby blues, it's postpartum depression. Yeah. And so you're wise to sort of look out for it in your practice. Do you do the Edinburgh test? Is that standard in your practice?
No.
Okay.
We actually screen by normal conversation. And if we find, we let couples seek help. And we give them we can give them consult, and also we can tell them so they can reach out to the help themselves. But it's stigma. It's not easy, people just going for the help. It's not easy. So I see even some people here, the family support just stood out and she become all her normal again. But I haven't seen, even if I suggest in some cases which we'll be discussing, hate. So even if I'm suggesting, it's not very normal people seeking out help, but they do sometimes. But our screening is not, it's normally by conversation and realizing what's happening.
You're probably asking 10 or 15 questions. You're probably doing an Edinburgh test in your own rights without realizing
exactly.
it.
Maybe we don't list the way the questions are. I know that listing, but we don't do it that way. We just do it probably. It's like normal conversation, and then you get to know that somebody needs help or not, and we give them then referrals to the right places.
Yeah, I mean, what's important, I think, is we get to talk and get this message out to the community that ladies having children, and it doesn't have to be the first child, they could have a great first birth. In my instance, why I was passionate, I mean, you don't know this, but one of the, when you asked me to come on to the podcast with you, I was really excited because my own mother had postpartum depression, and she had 4 children. I'm the last one, and her other births were fine. But when she had me, she had postpartum depression now. And we realise that now because we've got more research on it, but it went undiagnosed. And her relationship with me in the early years, I had to be fostered out because she wasn't handling her mental health well. And she had a predisposition to depression and anxiety before. So that increases the risk for postpartum. But it's devastating in the family because it can affect the relationships with their husband, the spouse, and also the children. And it's so important in those early years, that the mother-baby bond, the eye contact, the hugging, the cuddling, it happens. And the chemicals that are released into the body of the mother and the child are so important. But if that cuddling and that disconnect happens, those chemicals don't get released, and that can affect the development of the child. And we know now through research that those children can then go on to become adults with issues like anxiety and depression. So it's really important that we get this message out and destigmatize the community, because we need to talk about it more. And if we talk about it more, then other people are going to come forward, because, 30% of the mothers that have postpartum go undiagnosed, and those people go on to have depression after having the baby for up to 3 years. That's terrible.
But there are too much implication for the child, and I can see the empathy you practice. So you came out well, but it's not on for everybody. People can be having problems. And it can affect the bonding, and mother being the center of the family health. So this is the reason we probably say she's well, then the whole family is well.
Yeah. Well, sometimes what happens accidentally, and it can happen in single families or joint families, that you can find that you dismiss what could be postpartum as baby blues. And so what happens is, you might get a comment from your mother-in-law or even your own mother or someone in the family. Look, this is normal to feel upset.
Actually, my second case, which I'm about to discuss, it's with the in-laws. So first case we had full support from the mom and the husband.
Right.
Now second case is, I had a delivery, and she delivered well, everything was nice, and she went home. After returning home, she felt that she need more of the pillows, and she just went to the mother-in-law, and she says, I was asking her that I need more pillows, and she started crying. And she heard it's a seemingly very simple request, like she needs just pillows, everything is okay. She said, I cried and I was surprised that what's happening, why I'm just crying. But the good thing about this case, that even with the haze of this emotional thing, she could see clearly that it's not her, it's because of her birth and her, she's in the emotional landscape of delivery. So she could just process it. And she came to me, she discussed with me, and probably that was enough for her as I acknowledge her that, yeah, you're right. It's not you. It's just because of your hormones. You're into the hormone tsunami right now. And then she came next for next delivery, and I just remembered that thing. And I discussed with her before her delivery that I remembered that happened after your delivery. And she said, Dr. Bushra, I had time, I processed it all, and just because she faced it head on with the self-compassion, so she could clearly see that it was not her. So with the next birth, she was really strong, and she said, I moved on, and this time I'm really confident, nothing going to happen. And after delivery, when I enter her room, she was there, that cheerful, and she said, Dr. Bushra, don't worry, I'm good. And she was really good. So, even sometimes you don't have that support and judgments are around, but if you have self-compassion, and if you see this thing as external rather than you're like something is triggering your deep insecurities, you can still process it in a good way and you can overcome. So you can't go over it, you have to go through it. So she faced it head on with self-compassion, and she was good, confident, and the next delivery she knew what to do.
Yeah. And I think to add balance to that, I would say sometimes postpartum depression happens because of external factors that are outside of our control. So I'll give you an example. Hormonal imbalance.
Yeah.
We're not in control of that.
Yeah.
So estrogen levels plummet. Progesterone levels plummet. Oxytocin levels go right up. And in that, what did you call it? A tsunami? It's a fantastic...
Hormone tsunami.
Hormone tsunami. I've not
There's so
heard
many
that.
hormones.
But it describes it very well.
Yeah.
So it doesn't matter if someone's prepared or not. Do you remember I told you I was the fourth child? My mum's earlier children, she didn't have any problems.
Yeah.
So why, with all that experience, three children under her belt, so to speak, and with me, she went into postpartum. So there are different factors. There's hormonal, sleep deprivation,
Responsibility.
predisposition to other mental health issues that are in the past, childhood trauma. Having a baby can release childhood trauma. You could be holding your baby, and if you've had abuse in the past, if the mother
Deeper
was
wounds.
if the mother was abused, for instance,
resolved,
that can trigger. She could be looking at her baby right there and then and saying, how could someone do that to me? Whatever that was, the trauma. And that could bring out something. Your case that you just spoken about, where this lady was fine, why was she fine? And some of it's unknown. It's like maybe she had a very good support. Maybe the husband was really supportive. Maybe the people around her, she had people to share the load, so to speak. But not all families have their people around them, and they don't always share, do they? Or the comments they make.
But
like,
some people themselves are, they have that strength. So whatever they face, that we talk about resilience and all those things. Some people, they always bounce back. So I feel from her discussion, I remember she had more responsibilities after that because few things happened in her family, and she was the one who herself bounced back to those circumstances. And, I felt like she herself has that thing. And so, that can also work.
Yeah, but I would say to your listeners, there's plenty of resilient women that will get postpartum depression because of external factors, because resilience alone is not 100% a
100%.
protector to
Actually,
the problem.
now my third case
Yep.
is with the experience, as you say, that you were 3 already and you're the fourth one, then your mom. So I have a woman, I just delivered her, and they were amazing. Her husband was good, a child with them. So after delivery, I entered her room and I saw she was just laying and silently crying. And then, and she wasn't any other woman. She was PhD doctor.
Yeah.
So very educated. So she just realized that I'm in the room and she just got up and she said, Dr. Bushra, I think, and she was crying, Dr. Bushra, I think that I cannot take care of this baby. And I was like, you already did it. You have already a baby, a child, and you have done an amazing job with that child. So how you think you cannot do it? I mean, you already have experience. And then she said, no, I think this time I cannot do it. And then I have to reassure her that you're already doing an amazing job. Here is a child and it's being well taken care of, and I can see. And then I have to remind her that motherhood is not about being perfect. It's about showing up. So you could be with the messy hair, with being sleepless, being tired, still doing the job. That's important. You don't have to be perfect
sure.
mother. Sure. And then probably it helped or not, but when she came for postnatal checkup in the clinic, she was all good. And we had this picture together, which is still in my Instagram. So, being motherhood, even the second time, can stir deep insecurities in the mother and into the people who have already done those jobs.
Yeah.
So this hormone, it can strike women in a different way with each birth.
That case sounds like the baby blues, so
Yeah.
which usually happens in the first 10 to 14 days.
Yeah.
So most mothers will experience baby blues, 80%, say.
80%, yeah.
So what happens in that time is that mother will go through many emotions,
Yeah.
many thoughts, which will bring tears.
Yeah.
But your job as part of the team to help her through her birthing is
Yeah.
just to make sure, just dig a bit deeper and ask the questions, what makes you think that?
Yeah.
So because it's potentially a flag.
Yeah.
So it might be worth sort of discussing with the family in a supportive nature to just keep an eye on her. Let's see if it is baby blues. This normally happens.
Yeah.
And observe. And then after 10, 14 days,
Yeah.
the hormones start to settle.
Down.
She gets into a routine. And with the support of the family, she'll probably come out of that.
Yeah.
But she might not. And
Yeah.
that's where you come in as a professional to just observe, check up. And then if there are other flags, like she starts to talk about being hopeless or feeling she's not connecting with the baby, or she's even getting angry, and it starts to escalate, then you can
Help should come
intercept,
in.
and then you can then
Yeah.
advise and get the corrective support that she needs, because it may be baby blues and it may not be.
Yeah.
And we
Postpartum
know it
psychosis.
can then...
She looked harmless, so I didn't feel the need of help in that case. It looked like she's a perfect person who is just feeling that she's failing.
Yep.
So, yes, you're right. Sometimes it's not, people don't have baby blues and they have postpartum depression. This is also, so my next case is that example. So this lady, she was always upbeat, and she even had appointment to the beautician before delivery because she'll be having a picture with me. And then she's delivered. She came to the clinic for the picture of us together for our Instagram, for social networks. And she was looking really pretty. And I actually asked her that, you're shining a lot. And she told me that she actually had a appointment with the beautician. And then around 4 weeks, she comes back. And she's subdued. She's not same energetic person, not same radiant person. And she says, I am sick. And I said, why you are sick? She said, I think my placenta is inside. I said, it's not possible. But just because I had ultrasound in the clinic, I just said, let me objectively tell you that there's no placenta inside. I did ultrasound and I showed her there's no placenta inside. She became calm, but like I just felt like postpartum depression also can turn into false perceptions and some delusion that she's sick because of something. But good part was she wasn't thinking something delusional about that somebody else is there to harm her. She was just thinking that she is sick because of something else, because that was not her personality. So not having much of the knowledge about the placenta, how it works, she thought it's the placenta. But once we showed her, she was really calm, and I felt that her fear or her concern is just being resolved. So this can also take shape of some false perceptions,
Yeah, sure. I would say flag that, and then just keep an eye and ask the family if there are any other thoughts that she shared which would lead you then to have more evidence that, is it delusional or is it just some worries that she's having? Because often new moms will worry naturally, and that's natural. Is it rational or is it irrational? And if the family then bring you new evidence, actually there is some other things that is happening, then you've already flagged that. They can then report back to you, and then you can then monitor that and see if she's ticking the boxes for someone that's going into postpartum depression or even a postpartum psychosis, which is very rare. But you're onto it already, and then you can do something about it if it's necessary. But if you rationalized it with her and she accepted it, it might just be a scary thought. And new moms have a lot of scary thoughts.
Actually, I allow the visit with the husband. So whole family comes in. So they also have access of my number. So, and I always open up the discussion about the postpartum depression. So it's like anybody can call me and they can tell me about their cases. So I have one time call from mother of the girl, and now she's pregnant second time. And she told me that, Dr. Bushra, my daughter is suffering from this, and I used to make call to the daughter, and I used to keep checking on her. She's pregnant second time, and she's really vibrant, so she's good. So this was a false perception which I corrected, and it was resolved. But I have another patient who has a real delusion. I mean, she was really skeptical about the care of the hospital. So what happened, this girl, she was delivering and husband was in the room. He didn't enter ever, which is unusual. But I could see the fear in the eyes of husband also. And the wife, she was going through the labor all alone with our team, of course, but nobody from the family. And she had a good outcome. We gave her some augmentation because she had less pain. So we gave her some help with the pain drip. And she delivered healthy outcome of the mother and the child. And then I went for the postnatal checkup to her room. She was standing by the crib of the baby, taking care of the baby. And the moment she saw I entered, she moved in a way that her back was facing me. And I felt it awkward that, like she was supposed to talk to me. And then I started talking that, how are you? What's happening? She started opening up slowly. And she said, do you know, Dr. Bushra, nurses were trying to harm me. They gave me a lot of pain, and I was really in pain. And they were not helping me. And I said that pain was supposed to bring the good outcome and your normal delivery. And you see, here you are, you and your child's newborn, so healthy. But I felt like she was really skeptical about the care. She was thinking that hospital let her down, even though with the good outcome. And I tried to acknowledge her with her that you did an amazing job. You have this baby and everything is good. That pain was necessary because to deliver you. And if the pain would have been much more, it would affect the outcome of the baby also. But then at one point I felt she cannot, she is not ready for all those. And then I just told her everything is good. And I gave her space to process it on her own time. I kept following her, checking what she's thinking. In postnatal visit, I talk about that thing with her husband also, but I just felt they both were not ready for I tried to refer them to psychologists, not psychiatrists, that somebody can talk through. And I opened to those ideas, but I felt they were not ready. They were not ready mentally. And they just said that we will see, but they were not accepting that ideas. So sometimes those false perceptions or those delusions, they cannot be resolved. And then you cannot force care on people.
Yeah,
you can
true.
just tell them that they need it,
True.
but you cannot force those cares.
I think, with this lady you were talking about, I think whatever she said has to be respected
Yeah.
because it might be true.
Yeah.
It might not be true. Hopefully it's not true.
Actually, it's
but-
not true because that staff, that team was always praised.
Yeah.
And everybody, so if everybody's saying that team is amazing, and I know them, like how they respond to the things, to the emergencies, so I know that team very well. So, but, pain has to be there. But if some support from the family would have come forward and would have told her that it's normal, people have labor pain during delivery, it would have been resolved.
Let me go back to the
Yeah.
lady in question. What I would say is the lady made a statement, and it could be true and it might not be true.
Of course.
So you have to accept that what she's saying, she believes.
Yeah.
Because when someone's delusional, actually, they truly believe it.
Yeah.
But it doesn't mean it's true.
Yeah.
But we need to acknowledge that
To
belief.
let them process.
Yeah, and that is a flag. That's an opportunity for us to then investigate more, because there may be other things that she's saying that would flag up that she's going into a serious mental health issue. And then you can then refer her to her psychologist or psychiatrist. So I think we should always acknowledge what they say,
They're saying.
true or false.
Yeah.
And in that case, you just need to identify what is going on in her mind.
Only if we acknowledge, they will trust us.
Exactly.
Yeah. So now these were the cases probably resolved, but I have another case which has probably deeper wounds from the prior birth. And there was a husband who started during antenatal care, he started searching help around who could actually fit for the care for his wife. So I got this call, and he told me about the whole case, that his wife is very, very scared of the birth coming as she's pregnant, and she has real trauma during the last birth, which has not been resolved, and she's really in fear. I welcomed them. They came to me. We started discussing, even though prior was normal birth, but this time it was, they opted for cesarean. I tried to talk them out of cesarean, but they said, no, we want to go through cesarean. And then I thought probably this is the solution, which will not bring her postpartum depression again. But when I finished cesarean section, and I was still in operation theater writing my notes, nurses called me in recovery, and they said that, Dr. Bushra, mother doesn't want to see her newborn.
Yeah.
And that was a real red flag and emergency situation, because they are expat who will take care of the baby, and why she doesn't want to see the baby. I went to this patient, I tried to talk to her that why, and you have a cesarean, you have all the analgesics on, there's nothing else remaining, and you can see the baby. She wasn't ready. Maybe her deeper wounds, maybe she's still not feeling like connecting at this point. Maybe it will later will be all right. But for me, I felt she needed help. So I gave the urgent consult to psychiatrists.
Yeah.
And, psychiatrists, they are more about the medication rather than talking the person through. So at that point, I felt she needed medication. But what I like about this case, that husband recognized it earlier during antenatal. He started searching help. And even he agreed for cesarean section, it was costlier for him because he felt this was the right solution. And when we let the psychiatrist come into the picture, he was all receptive. Even the woman herself acknowledged that she needed the help of psychiatrist.
Yeah. And so you did the right thing. And what did the psychiatrist do?
Actually, they started meds, but later on, when I saw her in the postnatal visit, she was with the baby. So whatever the help she needed, she got it.
Okay.
Yeah.
So he probably prescribed SSRIs.
Exactly.
And so what I would say is cognitive behavioral therapy is the golden way to approach this as well. So medication is appropriate, and at the same time, talking therapies help, because some of the irrational beliefs that we have sometimes when we go into depression, they can be talked through and reframed with a professional CBT expert.
Yeah.
So what we tend to do in the UK is we're using medication and CBT as a joint approach, a collective approach, and it tends to be more effective. But she may have received that as well on the recommendation from the psychiatrist to a psychologist.
It's multidisciplinary, yeah.
So and also what she could do on her own bat is use some alternative therapies like meditation. It's wonderful. Mindfulness, because in mindfulness, we're able to come out of the thoughts that actually steer us into depression. Right. So coming out into the present moment. So if you can find a well-trained mindfulness practitioner in conjunction, and that I must stipulate that, in conjunction with her medics, with her drugs from a psychiatrist. So nowadays there's a collective approach to the problem. It's not just one cat fits all. First of all, medical intervention. Then secondary, empowering the mother to take responsibility of her health. There's a wonderful acronym called NEST. Nutrition, really important. Exercise. When we exercise, we're releasing endorphins, and also gives us better sleep. So nutrition, exercise, sleep. Now in sleep, we release more serotonin, don't we, in our sleep? So that's going to help the mother. And what's most valuable, time out. A break for herself.
Yeah.
Those four things can help in conjunction with medicine.
Yeah. And for new mother, this all can be hard, especially sleep deprivation, time out. Yeah. And actually, they can have help around and somebody can help them for the time out. So support, again, is really important, yeah. In the beginning, you were talking about your mother had postpartum depression and postpartum psychosis. So I see like your resilience and the way you came out of it, and maybe this is the reason you are so good at it. So let's talk about it.
Yeah, I think from all negative things, there can develop positive things. So I think you're right. Partly the reason why I do what I do is because of the journey that I had. And part of that journey was having a mum with anxiety and depression and postpartum depression. Yeah. So, she slipped into postpartum psychosis and tried to harm herself and me. And I was removed from that environment. I went into foster care for a short period of time. And as she recovered, then she had me back. But we know if postpartum depression doesn't get addressed, that people will then go on possibly to have depression for another 2 or 3 years. So it does need to be spoken about, and it doesn't. What you're doing today, just getting it out there to destigmatize and allow people that are listening to accept that this is something that needs to be seriously looked at and talked about within families, because they can do so much if they're about to have a baby. If we can preempt what possibilities, it's not dwelling on the negative, it's educating people to understand that you can get baby blues or you can get postpartum.
It's 80%.
And what are the signals and what are the indicators? Yeah. And instead of carrying shame, because, some mothers are thinking, I don't want to share my thoughts because it's wrong. I shouldn't
Things are
be.
wrapped.
Well, I shouldn't be
resolved.
having these thoughts in the first
Yeah.
place. There is a very, very small percentage of people, I might add, that will suffer from postpartum psychosis. And they usually are in a very vulnerable state. So it's really important that they seek help, or the family seeks help, because that person might not be in a mental state to seek help
Yeah.
themselves. So they need to sometimes reach out, even for the emergency services,
Others
because they
should
could be
recognize.
thinking about harming themselves or their baby. And so those indicators are like you talked about, where they're disconnecting, they're feeling hopeless, or they're even suggesting that they don't want this baby, or they'd be better off without that child.
Yeah.
These are serious indicators, and they need psychiatric intervention,
Yeah.
I'd say, straight away.
Yeah, it's an emergency postpartum psychosis. So we had this wonderful discussion with Russ. So if you think somebody in your friends and family might be suffering from postpartum blues or postpartum depression, you support them. Sometimes the support and help from the family and friends is enough. But if you think the issue is not resolved, then suggest that they need professional help, because there is nothing wrong in seeking help. So there's a certain ritual in our podcast, She's Well, that guest lit the candle. And this candle is a hope that these conversations should go on, and she, being the center of the family, be well, and the whole family be well.
My pleasure.